This portion of Living in the Heart of Virginia is sponsored by
Rehab Associates of Central Virginia.
Whether you're a weekend warrior, an athlete, or an admitted couch potato, we all get injuries. But fortunately, Rehab Associates is here to help, and I'm here with Harrison Hunt to talk more about it. And you all have been in Bedford for a very long time. Tell me about this.
We've been here for about 14 years. And we opened at a smaller space and have been able to grow as the community has learned our location and the services that we can provide.
And speaking of growing, Rehab Associates is growing and growing overall, and there is a location near you, really, in a lot of ways.
There is. I mean, as we've grown here, we've started seeing a lot of patients come from the lake area. As that area has grown, we were able to open a location in Moneta, which has serviced the clientele in Moneta and Huddleston and the lake area.
And you serve people young and old, right?
We do. We see anyone from the high school athletes, the injuries there, to someone that's in their 70s or 80s that wants to play with grandchildren or wants to travel to Europe and feel better and be able to be more functional.
And the thing you were teaching me is there's a lot of seniors in this area that really do want to just keep on going, and that's what you're here for.
That's right. I mean, it is amazing as I treat the population. They're just such a fun population. They want to be active, and some of them have noticed a little problems with balance or falls or even just the chronic back pain that they have. We see them once a year and kind of get them back on track and do an evaluation each year, and it's just a great population to treat.
And do you suggest that, to kind of check up every year?
We do. We try to educate people that it's important to almost treat us like you would treat a physician for your blood work and things. And we can do a yearly evaluation for musculoskeletal screens, see where you are, see if you have any problems. Generally, there's some kind of chronic condition as you age that just needs to be addressed and maybe adjusted each year.
And the one thing I like about you guys, too, is that you're direct access. I've gotten a couple back injuries over the year, and I've learned to treat myself faster, and you can come directly to you all. And this is often a better idea than just, waiting it out, right?
Absolutely. I mean, the faster you can get in, the studies show that it's a lower cost in healthcare, and you recover a lot quicker. You get back in the game, get back to your lifestyle. It's a nice way to just get in quick and get back in the game.
Mm-hmm. And I didn't even have to see my doctor. I just came directly to you.
That's right. But most insurances, the federal insurances, you still have to have a doctor's referral, but most other insurances, or if you want to self-pay, you can come right to us, and we can generally work you in within a couple days.
Another great thing, too, is the avoidance of chronic pains over time, like if you come to you all, avoiding surgery, expensive things like that.
That's right. That's right. I mean, if you can get in quickly, generally the recovery rate's much slower. A lot of times patients are waiting for test results or they're waiting for their doctor visit, and it turns into a chronic condition over time as they're waiting. And sometimes we can just do that evaluation and determine if it's appropriate for physical therapy and treat them quickly.
Excellent. And I'm also here with Dr. Schreiker. And let's talk about the services you all provide here. What kind of issues do your patients come in with?
We see a wide variety of orthopedic conditions, like Harrison mentioned, kind of all age groups. Mm-hmm. And I also treat vestibular disorders here as well. And vertigo is the most common that we see in this clinic.
Let's talk some about that as well, because there are crystals in our head. And that's such a fascinating thought. Are they really crystals? I mean, what does that mean?
Yeah, so the crystals, the official name is otoconia. They're little calcium carbonate particles, and they help with your balance. So with vertigo, they get knocked out of place and start floating in the canals in your inner ear, giving you the sensation that you're spinning when you're actually not spinning. And most people have problems with things like looking up, bending over, and sometimes rolling over in bed.
And so then how do you treat this?
We can treat that with a quick 5-minute maneuver. It's really effective, usually in 1 to 2 treatments with therapy.
And then do you learn how then to treat this yourself at home?
Absolutely. There's exercises we can give to people at home to help them manage their symptoms if they do recur.
And is this something we get as we age, or does it depend?
It depends. It's definitely more common as you get older, but it can also occur after a fall or a head injury.
And you guys have a lot of locations, like I'd mentioned before, and you guys are award-winning overall, aren't you?
We are indeed. We're very proud of that fact. We do our best to treat our patients and help them reach their goals.
Wonderful. And to locate a Rehab Associates near you, give them a call at 855-RACV4PT or check out their website at racva.com or Find them on Facebook.